question is in the name of Assembly Member Jenny Jones.
Thank you, Chair. I don't know about you, but it's not the same when we don't have the Tories here to shout and heckle. And, you know, it's you need an opposition, and I do regret they're walking out. I think, I don't know, perhaps they're off. Perhaps they think they're part-time Assembly members, just like we've got a part-time mayor. I don't know. But what a shame. What a pity. Now, this motion on obesity is, I hope, going to be something that the Mayor will recognise. I hope we pass it, and I hope we can take it to him and actually that he can acknowledge it. Because latest figures show that 1 in 5 children aged 10 to 11 are obese. And if you include overweight children, it becomes 1 in 3. Plus, 2/3 of adults are obese or overweight. And according to the London Assembly's Tipping the Scales report, that was in 2011, almost 250,000 children in London are obese, and the number is growing. The prevalence of children at risk is highest in London's deprived areas, and it gets worse based on current trends. Half of all children will be obese or overweight by 2020. And the message from the medical profession is clear. Obesity is the greatest public health crisis we are facing. Obesity programmes and policies have been largely piecemeal and disappointingly ineffective, and unless effective action takes place, the NHS will no longer be able to cope. The current cost to London's NHS of overweight and obesity is £2.3 billion annually, the equivalent of over £700 for every household in London every year. I'd like to congratulate the Academy of Medical Royal College's widely publicised report measuring up the medical profession's prescription for the nation's obesity crisis. It was published last month, and it represents the views of the vast majority of the UK's 220,000 doctors, surgeons, GPs, paediatricians and Royal Medical Colleges. And the report concludes that despite extremely good measures, such as the 5-a-day scheme, which I've got to say is for wusses. In other countries it's 8 a day or 10 a day. So 5 a day is really a low bar. That was the setting of nutritional standards for both primary and secondary schools, following Jamie Oliver's Feed Me Better campaign. But tackling obesity is still largely piecemeal. To remedy this crisis, the Academy of Medical Royal Colleges has set out 10 recommendations it believes must be taken to make real inroads into this crisis. These fall into 3 broad areas: actions to be taken by the healthcare profession, changing the general environment on obesity, and 3, making healthy choices the easy choice. Now, some of the recommendations or variations on them have or are being in the process of being delivered by the GLA. For instance, Healthy Schools London is a proven and effective programme which has a track record of delivering far healthier food in schools for targeting obesity. And contrary to the Department of Health's inexcusable exemption of academies and free schools from complying with national nutritional standards that are applicable to state schools, who allowed that? Who in the government thought that was a good idea? The Mayor has assured me in Mayor's questions that the academies he supports do comply with these standards. And the Mayor has a takeaways toolkit which gives local authorities the tools, the case studies to develop a response to the health impacts of fast food takeaways. Now, despite my concerns about how few schools the Healthy Schools London £200,000 funding a year will reach, and how nutritional standards will be enforced in the Mayor's academies, and to what extent his takeaway toolkit will limit or reduce the number of fast food outlets around schools, these measures from the Mayor are actually going in the right direction. However, last summer at the London Games, the Mayor said that so long as the food and drink sponsors, Coke and McDonald's, promoted the importance of a balanced diet, the benefits of regular exercise, and providing they are fully committed to the philosophy of healthy eating, all is fine. Now, clearly it's complete nonsense and undermines parents who are trying to influence their children, and it undermines public health campaigns. The report Measuring Up points to clear evidence that advertising of junk food and drink does have an effect on children's buying behaviour and consumption, and that's why they're calling for a 9 p.m. ban on such advertising. So the Academy of Royal Medical Colleges report, Measuring Up, represents the view of the medical profession and provides a clear and comprehensive roadmap of evidence-based measures to tackle obesity. Their warning is that unless effective action takes place, the NHS will not be able to cope with obesity and with related medical problems. I therefore urge you to support this motion, which endorses their findings and recommendations and calls for them to be reflected in future obesity policy or strategy, whether directly through the Mayor's own programmes or in his potential new role as the Chair of the emerging London Health Board. Thank you.